Aloha. Thank you for joining us in this continuing discussion, comprehensive discussion on the healthcare crisis in Hawaii, sponsored by the senators from the Big Island. My name is Josh Green. I'm senator from Hilo and a physician in the community. To my left, I have Dr. Craig Shikuma today, who's both the East Hawaii Regional Board member and also the director of the Long Term Care Facility in Hilo. He'll be one of our experts today. Further to his left, we have Mr. Stuart Ho, who is also got two hats on today. He's both the president of AARP Hawaii, a position that really informs him on this matter, and also a member of the Long Term Care Commission, an important commission here in Hawaii on this issue. To Mr. Ho's left, we have Pam Bruce, who comes also to us from East Hawaii, Hilo, where she is the Long Term Care Supervisor at Hilo Medical Center. Sees a lot of patients, takes care of a lot of people. And then once more to her left, a colleague and good friend, Chairman Takamine, who is the senator from District 1, which is, as everyone knows, Hilo, Hamaku, and Waimea. So today we're going to have a very informal discussion about long-term care, and we thought that the audience might like to know about this part of the healthcare crisis in Hawaii. So if we could, we'll go right to our expert panel today and start with you, Mr. Ho.
Thank you. We have, AARP has no choice about long-term care. I mean, the people we represent are in the group that requires most of it, and so we've spent a lot of time in research and so forth, trying to get a handle on this subject. The reason, I think, for several studies that have come out, one as late as 2008 last year, and one about 2 years ago, is illustrated in this graph. I'd like to throw on the screen. Can you put the demographic? There we go. The solid line represents from a base of the year 2000, which was the census. The solid line is a line that traces the growth of that age bracket between 50 and 60. 75 and over, the 75 and over population. And the dotted line represents the population between 50 and 64. Now the solid line is the group, represents the group that is most likely to have long-term care problems. The dotted line represents the group that traditionally has provided most of the caregiving for people who have disabilities because of age and so forth. Where we are currently is in that second tick on the bottom, where that says 2010, and the rest of it is extensions into the future. But I think everybody is familiar with Hawaii's aging prospective, and we understand what it implies for long-term care. What we may not understand is something that very few people have put a number on. AARP did a study, as I said, last year, and what they did was they put in they attempted to quantify in value the price of services provided for free by the long-term care providers in the state. And the number they came up with, using an $11,000 value per provider, it was like $1.4 billion. Now you take that number and you see what the projections are in the future, and obviously that value is going to rise. And what it means for public policy makers is that I'm sure they don't want that problem on their doorstep, because it will be very, very expensive. But you can see that the class of caregivers is going to be outstripped by the class that receives that care, and that's not too far in the future.
Let me actually ask you a question as a group, and then we'll just to frame the issue. We recognize that we have an aging population, and that these are people that need care and it's difficult to get care. Maybe we'll ask Dr. Shikuma, as the medical director of the facility in Hilo, what does it mean on a day-to-day basis to get long-term care to an individual?
The biggest issue we have at Hilo Medical Center is probably the logjam of patients, so to speak, and I think I've spoken about this before to you. The acute care medical hospital, there's a continuum of care from a patient gets into an emergency room and gets into acute care, the regular part of the hospital, gets their problem taken care of, and then has to be either discharged or transferred to a long-term care facility. But what happens is that because there's a dearth of beds, the long-term cares on the East Hawaii side are unable to take patients quickly and transfer from acute care beds. And then the patients back up. And at its worst, we had patients waiting days because they couldn't get out of the emergency room because they couldn't get into an acute care bed because the acute care patients couldn't get into a long-term care. Okay, and when a long-term care patient is inappropriately in an acute care bed, that's called an overflow, or it's called a wait list patient, and that is a tremendous cost for hospitals all over the state. And at Hilo Medical Center, I think, or on the East Hawaii side, I think I saw figures that it's amounts to about $5 million a loss per year, and statewide, I think closer to $60 million. So we have a tremendous problem financially with these overflow or waitlisted patients because of the lack of long-term care beds. We also have a tremendous problem, of course, with inappropriate care. I mean, it's not worth it to waste an acute care bed, a high intensity of care, nursing staff, and so forth on a long-term care patient that probably needs rehab or might just need domiciliary care, day-to-day washing and bathing or feeding and stuff like that. That's our biggest challenge, day to day. It's like I told people in Hilo, it's like the Alamo and we're losing, man. Too many patients, not enough services, and long-term care is no exception. It's interesting your figures. When I looked at that, I was thinking about the doctors on that dotted line. That dotted line is, right over that hump. I think it just stops because I think the doctors will be retired by then, and that's another big problem. We're going to have the aging doctor population, the provider population, the professionals, medical professionals are going to age too, and that's a big clot of services.
Craig, I really appreciate you kind of explaining that, because a lot of times, people aren't aware of some of the dynamics within the healthcare delivery system that might cause a delay before they get any kind of medical services. But I wanted to maybe go back to the study, and Stuart, we really appreciate AARP and what it's done to provide additional information, especially because given our demographics, this is just going to it is already becoming a larger and larger concern. Could you maybe very briefly highlight some of the findings, because I'm sure what you found in the study would be applicable to the Big Island community?
Yeah. Well, let me give you some of the general findings first. If I can get the next graphic on, please. This is we did a. I've got a graphic over here that basically shows generally what Hawaii thinks, and what they think is this is as of last year, January. 75% of the population just doesn't think they can afford 1 year of nursing home care. I mean, you're talking about rates over $100,000 in the private, for a private room or semi-private room, or even a ward rate is pretty expensive. 40% of Hawaii is not confident they can even afford 1 year of care by a home health aide. And 6 in 10 people in Hawaii say that health care and long-term care in Hawaii are either in a state of crisis or have major problems. Now, we've also taken snapshots of the major islands, and what it shows in the case of Hawaii County is fairly interesting. The numbers we see for Hawaii County are that 49% of the population of